Hello, my name is Tiffany. I'm a registered nurse in the adult cardiac cath lab. This video will demonstrate the procedure to prepare and administer cangrelor for injection as presented in the KENGREAL full prescribing information. Indication: cangrelor is a P2Y12 platelet inhibitor indicated as an adjunct to percutaneous coronary intervention, or PCI, to reduce the risk of periprocedural myocardial infarction, MI, repeat coronary revascularization, and stent thrombosis, ST, in patients who have not been treated with a P2Y12 platelet inhibitor and are not being given a glycoprotein 2B3A inhibitor. Important safety information: cangrelor is contraindicated in patients with significant active bleeding. Cangrelor is contraindicated in patients with known hypersensitivity, example, anaphylaxis, to cangrelor or any component of the product. Drugs that inhibit platelet P2Y12 function, including cangrelor, increase risk of bleeding. In Champion Phoenix, bleeding events of all severities were more common with cangrelor than with clopidogrel. Bleeding complications with cangrelor were consistent across a variety of clinically important subgroups. Once cangrelor is discontinued, there is no antiplatelet effect after an hour. The most common adverse reaction is bleeding. Instructions: use a clean surface to reconstitute cangrelor. Wash hands and don gloves. Use alcohol pad to wipe top of cangrelor vial and port of 250 milliliter normal saline or dextrose 5% bag before each needle insertion. Preparation: cangrelor is intended for IV administration as a bolus and an infusion after reconstitution and dilution. For each 50 milligram vial, reconstitute by adding 5 milliliters of sterile water for injection. Swirl gently until all material is dissolved. Avoid vigorous mixing. Allow any foam to settle. Ensure that the contents of the vial are fully dissolved and the reconstituted material is a clear, colorless to pale yellow solution. Reconstitute the vial prior to dilution in a bag. Parenteral drug products should be inspected visually for particulate matter after reconstitution. Do not use without dilution. Before administration, each reconstituted vial must be diluted further with normal saline sodium chloride injection, 0.9% USP, or 5% dextrose injection, USP. Withdraw the contents from one reconstituted vial and add to one 250 milliliter saline or dextrose bag. Mix the bag thoroughly. This dilution will result in a concentration of 200 micrograms per milliliter and should be sufficient for at least 2 hours of dosing. Patients 100 kilograms and over will require a minimum of 2 bags. Reconstituted cangrelor should be diluted immediately. Diluted cangrelor is stable for up to 12 hours in 5% dextrose injection and 24 hours in normal saline at room temperature. Discard any unused portion of reconstituted solution remaining in the vial. Recommended dosing: the recommended dosage of cangrelor is a 30 microgram per kilogram IV bolus, followed immediately by a 4 microgram per kilogram per minute IV infusion. Initiate the bolus infusion prior to PCI. The maintenance infusion should ordinarily be continued for at least 2 hours, or for the duration of PCI, whichever is longer. Administration of bolus and infusion: administer cangrelor via a dedicated IV line. Step 1. Bolus. Remove the bolus dose from the diluted solution never from the reconstituted vial. Administer the bolus volume rapidly, less than 1 minute, from the diluted bag via manual IV push or pump. Ensure the bolus is completely administered before the start of PCI. Step 2. Infusion. Begin the infusion immediately after the bolus and continue for at least 2 hours or for the duration of PCI, whichever is longer. This concludes our presentation on the KENGREAL dosing and administration instructions. Please see the full prescribing information link on this page. Thank you for watching.